lens and a microscope, telescope, or these TV cameras, it helps to focus. As we get older, the lens becomes more brittle microscopically, so it loses focusing ability, i.e. reading glasses in your 40s or 50s, and the cells of the lens don't get desquamated, they get compacted into the lens as the lens fibers continue to produce new cells throughout your lifetime. So there's only so much space there, and so it becomes more, we call it a nuclear cataract, it becomes more compacted, and ultimately clear becomes yellow, yellow becomes brown, and ultimately brown will become black if you let it go that long. So that the lens becomes discolored, can't focus, and you lose your light transmission through it.
And that's what happened, because I remember all of a sudden I thought my computer screens were not working as well because there wasn't that vivid color. And then what I realized is during the day, I was horrible, because all of a sudden everything's contracting, and I'm trying to look through the center, which seems to be the highest density of deposit.
That's exactly correct.
So it felt like in my car, I have a steering wheel. And it's got a big plug in the middle that I can't see through, but my eyes adjust and look around. So at night, it seemed like my eye opened up that big.
That's correct.
And I could look around the center
exactly
plug.
Correct. Yep.
But during the day, when everything constricts, I got too much of the area blocked out, and I couldn't see anything.
That's right. Less light getting in, and the light that was getting in was being blocked by the lens of the eye.
So at that point, really, I don't have a choice. I mean, being blind didn't seem like a good alternative.
That's correct. So we like to intervene at that sweet spot where the patient's symptomatic, but it hasn't become overripe, where it might be more tricky or more complicated to take it out. That's correct.
Now, I hear a lot about mapping the eye, using today's computer graphics.
Yes.
Especially in old fat men who are diabetic. They seem to like to take pictures.
Yes.
So they can compare and see if there's any of the, the tiny veins deteriorating. Is that become common?
Absolutely. Ophthalmology is a very visual science, so if we can see it, we want to photograph it. If we can photograph it, we want to photograph it over time. So you name the part of the eye, and we can take detailed photos, whether it be digital type of photographs or ultrasound. Those are two sciences that have developed very well in the field of ophthalmology. We also have laser scanners now. So we don't talk about scanning the eye or studying photographs of the eye. We can study any sub portion of the eye in great detail to a degree that was just unheard of 10 years ago. And the technology continues to change. More of it is becoming more three-dimensional. So you can map a diabetic retina and see it in 3D and map those changes as time goes by. The whole goal being not just to take nice, pretty pictures, but to be able to intervene therapeutically before there's sufficient vision loss that may not be reparable.
But doesn't that come with a pretty hefty technology price on the MD side?
Absolutely.
I mean, these toys can't be inexpensive.
That's what you hear about it's what the whole discussion that started in the last few years and will continue, is trying to find that right balance on the national level, on the federal level, between all the expenses required to run the country and how we're going to provide good health care for the citizens. But you're absolutely right.
Yes. Talk to a lot of the traditional primary care physicians. And it seems like you're getting back to the old days when we had the care. When we grew up in Milford, this is back in the ancient times when the dinosaurs ran, we had 4 physicians. And we all knew them, because you were either born by Dr. Chetty, Dr. Mastriani, you go through it. There's 4.
Dr. Pastorello.
You sit there and everybody knew.
Yeah, of course.
And they knew you.
Yes.
And you didn't have to try and put on airs because, they knew exactly. But there's a conflict now, because I've heard over and over that with Medicaid especially, because it seems like Medicaid is your lowest, Medicare is a little better, and then you hope for a lot of independent insurers, because the Medicaid patients don't even cover expenses for a lot of the traditional primary care health providers. How does that affect you? 'Cause I've heard people say, I'd love to take more and more Medicaid, but I have to limit myself or I can't feed my family.
Well, that's a good point. I'm probably not your typical physician in that regard. I was raised with a different outlook, and I've carried that through my life. I fortunately we put the patient, and I don't mean to be altruistic here, but we put the patient first. I'll never refuse to see a patient. I always come in on.
Yeah, but if you go out of business,
I understand.
I mean, the
It's-
killer
yeah,
is
yeah.
love the attitude. But if
Yes,
you took
yeah.
on all Medicaid
That's
and went
true.
out of business,
Yes, yeah.
then you can't help
That's
anybody.
exactly correct. And
And you probably have a family like mine. I mean, very, how would one say, they're not giving in the fact that they want to eat every day. They want clothes.
That's
They're
true.
very
Yes,
selfish
yeah,
that
yeah.
way.
Well, there's certainly, I don't have an answer for that. I certainly understand it, and I certainly agree with it. I think that I think I bury my head in the sand over it because I can't control that, and I feel what I can control at my individual private level up on, 145 West Street is simply to give good care, and hopefully there'll be more payers than non-payers, and we've been successful, I guess.
But
You know-
does the feds, when I look at CPT codes and things on that line, are they getting better or worse at covering, like when you say mapping an eye?
They are getting worse. There is no question. Now, and that's, I guess, what I could say to that is I enjoy my specialty as much today as I did 30 years ago. So I'm not probably the best person to answer that. But there's no question that we feel as physicians that it's being ramped down against us very much and ultimately hurting patient care. There's no way to justify what's happening here in terms of the fees payable to us. And nothing against plumbers or any of the tradespeople, but they make more money doing their thing than I do doing mine.
And they don't have to spend $500,000
That's
outfitting
exactly right.
a suite.
You're absolutely right about that, and it's something that's going to be hopefully worked out, because what you'll find is, in my opinion, there's going to be fewer and fewer people wanting to go into private practice. I've had ads out to hire another doctor, and they have so much debt coming out of medical school, and they have such high expectations salary-wise that there's a major disconnect between what I can offer them and what they're looking for. And in general, they're not old school like I am. I was a risk taker, I am a risk taker, and I enjoy what I do and I enjoy the practice. But the younger doctors are finding it hard to get through medical school, get through their training, and then to be able to afford a private practice. It's going to be very difficult. And it's
Well, I
gonna get
remember when a
worse.
friend of mine graduated Holy Cross,
Yes.
went to med school, and all of a sudden he wanted to set up an eye care center, private practice. And we were close enough. He said, it's amazing how many years I've put in. Now, you've been able to work all that time, but I'm walking out of school owing $400,000, and now I need another, back then, $300,000.
Yep, to
He
start.
says, I'm $750,000 in the hole, and I haven't earned a dollar yet.
Mm-hmm.
So the gross revenue looked really good on paper. But when you had to service $750,000 worth of debt,
Yep, and that's before you buy a house.
that was just his business.
Yeah, exactly. Yep.
And
Yep,
again,
yep,
that's before you have these offspring who want to be
yep.
fed and clothed
yep.
and everything else.
And you're absolutely right. You hit the nail on the head. I don't have an answer for it, and I hate to think that maybe I wouldn't have done this again if I was 30 years younger. I don't know.
Well, I know I had the discussion with my daughter, my youngest, when she was looking at, do I go into biotech business or the medical profession? And I said, sweetheart, you got to follow your passion. This is not a profession anymore that you go into because it's pure comfortable living, a very large salary without killing yourself. Everything you hear today is the MDs are working really hard for their money.
Exactly.
Not like
Yep.
50 years ago
No.
when,
It
you
was
could work 3 days, 4 days a
Yeah,
week.
yeah.
But now, question always comes up on contacts.
Yes.
Somebody comes in, and I've never had contacts. I was always told I don't have the patience for them. But how do you decide? Do I get glasses? Do I get contacts? And then, of course, if I'm getting contacts, I mean, I saw this whole thing about these knockoffs you buy on the internet for 2 cents a piece that weren't quite sterile and weren't. But let's start with to contact or not to contact.
Well, it depends on the motivation. If it's a young teenager that wants to get out of his or her glasses, simple, rather straightforward prescription, go for it. Then when you get older, in your 40s or 50s, if you want to avoid reading glasses or bifocals, then it becomes a little bit more tricky getting fit successfully. And then if you have, and you're in the cataract age, in 70s and 80s, most people aren't interested in fiddling around with a contact lens. So they're certainly popular. They've been popular, of course, for generations. The technology keeps advancing, and with the advent of LASIK surgery, that's taken a cut into the contact lens portion of the population. People that previously were wearing or might have considered wearing contacts now are having laser surgery. But it's still got a certain niche there, and I still enjoy fitting them. I enjoy dealing with I enjoy treating the complications when they come up, and it's part of the whole package of treating patients. But again, we don't particularly care where patients buy their contacts, but they have to follow the hygiene rules. We don't want them, overwearing them or certainly buying stuff off.
Well,
the
you
internet.
have now. My daughter got them
Yes.
to wear once a day,
Yes,
once a week,
sure.
Tuesdays, but not on
Yeah,
a
yeah,
Buddhist
yep.
holiday.
Yeah,
I mean,
yeah,
I can't
yeah.
figure out the rules.
It depends on the style, and you've just got to understand it. Of course, the most hygienic, theoretically, would be the daily disposables. You wear them, throw them out, wear them, throw them out. So there's no germs that can build up. Then you got your 2 weeks or your monthly disposables, your 3 months disposables, your annual ones that don't
Wait a minute,
dispose.
you'd have contacts in for a month?
No,
without taking
well,
them
you
out?
can. I mean, some of them are approved by the FDA for overnight use for that long. In my experience, my practice, we never allow, or if you will, or
Advise,
advise
recommend.
any overnight use. It just creates a high risk of infection.
You're still better off taking them out and washing
Absolutely,
them
yes,
every night.
yep, yep.
But now, if I buy my lenses through my eye care professional, I got a better, at least in my mind, I would expect that you're not going to sell me who contacts.
Well, that's absolutely right. And thank you for saying that, because what we do at my practice, and it's all I can speak to, is to deal with that issue so we always know what brand the patient's wearing and what strength and curvatures when they're being replaced. We just basically sell them at a minimal to no profit because we can computerize the delivery of the lenses. So if the patient's traveling somewhere or they lose one somewhere, we know immediately what they're wearing. Or if they skip a few visits, they come back a year later, 2 years later, we know exactly what they were wearing when they lost it or what the problem is. We don't really care per se where patients buy them, but we realize at a higher level that there's a benefit to having everything centralized. So we try to.
Well, I mean, I can see why you don't care because you're not making a lot of money on
Exactly.
it. So
Yeah.
But from a patient point of view, do I really save that much going on the internet?
Not with my practice, you don't.
Okay.
Because,
so realistically, if I'm paying a little tiny premium to know that you're watching out for me,
Yes. Yeah.
I can understand that. It's
yeah.
not double the price or anything.
Oh no. And no.
Now, Halloween comes, and I see all the issues of kids
Yes.
who go on and buy, and I don't want to pick on the Far East, Chinese contacts that change your eyes to orange.
Oh yeah.
And then you find out the reason they're sold at novelty stores for 2 cents or $1 a piece is that's what they're worth, and they're not quite sterile.
Yeah.
I mean, I mean, that would scare the heck out of me to take something
absolutely.
that isn't at an FDA level
Of
and
course.
stick it. I mean, it's not like it's bad enough if I wear a ring and I turn
sure.
my
Yeah.
finger brown
Yeah.
or green, whatever.
Yeah.
But on a mucous membrane?
That's exactly right. So the reputable companies in the United States that make regular contacts make the novelty contacts.
Oh, they do.
And they're manufactured to the same high standards. So that's always fun, given.
So again, if I want to go crazy and
Yeah.
have blue, purple,
Sure.
I mean, Portuguese
Yeah.
with blue eyes,
Yeah.
that would be a new thing.
Yeah.
But I could go to my eye care
Absolutely.
and say,
You should do it
Dr.
that way.
Goodman,
Yeah.
I want blue eyes
Right,
for the week.
just for the night or the week or whatever. Absolutely. Or you want the the bowling balls or whatever.
the
it is.
weird stuff.
Yeah,
but
yeah.
I don't have to try and, because when I saw these articles,
No.
there are kids who are permanently putting their
absolutely.
eyesight at risk.
Well, it's very sad. I mean, you have no idea. I mean, some of the infections that can be into contacts can persist for months and require corneal transplant surgery.
Oh, Lord.
Absolutely, yes, yep.
So besides the three that we've hit,
Yeah.
what would be the thing that keeps you the busiest on the other side, not the surgery?
On the medical side, I would say, well, of course, the three that we mentioned, and I'm fortunate to work with a good friend, Dr. Arnold Kroll, out of Mass Eye and Ear. He's a retinal specialist, so we share. He's right down the hall if I have a question about a retinal finding, a diabetic patient. Occasionally, throughout the year, once or twice a year, we find a melanoma of the eye that can save the patient's life by diagnosing that. Any number of inflammatory conditions related to rheumatoid arthritis. You know, and I forgot to mention that a third of my training in my residency was in pediatric ophthalmology. So when you get the screaming 6-month-old with the nervous mom, nervous dad, either you, as the ophthalmologist, either you feel comfortable in that environment, which I do, or you don't. You start getting jittery, and all the anxiety in the room is building.
That would, I mean,
yeah.
my daughter is screaming, "Dad, fix this." You can do what you want to me, I don't care. But I can see my tension level is going to be up in the stratosphere.
It might be the parent's first baby, and the eye is turned in, or the pediatrician sent them over. Your child's got, so I enjoy that. I mean, that takes longer to do the exam. We don't make any more money or anything else. But if you can help the family understand, or if you need surgery or you need patching, it's a hoot.
First of all, calm me down, because
Yeah.
that's going to help.
Yes, yeah.
Because the child is going to be looking at Dad, and if Dad is freaking out
Yep.
because the eye care specialist is making
Yeah,
him nervous.
you got bullets sweating on your forehead, then the parents know maybe this ain't the right place, or
Right.
maybe this guy doesn't know what he's doing. Now, one of my medical school classmates is a senior doctor at the Children's Hospital in ophthalmology. And so I have a good rapport with her. She's a very nice woman, and she's been there, and I'd be referring to her when need be. So that's one aspect that I enjoy. And just meeting patients over the years, I'm now dealing with, I'm getting old because I'm dealing with patients that I've operated on their grandparents, you know, and it's
So
been
you
a
know
blast.
the family history already.
Oh my God, yeah. I've operated on my high school principal. I've operated on teachers of mine, classmates of mine. You know, it's who else can say that? I mean, it's just a wonderful experience, and I still enjoy it every day. It drives me. And just a little anecdote: when I was younger, I remember like it was yesterday. I was in the 10th grade at King Philip in Rentham. My mom and dad were having dinner, and what do you want to? You know, we were just talking about what do you want to do, and said I think I want to be an ophthalmologist. So my mom, she's secretary, and you know, as normal as you could be, and she says, "That's good. Why don't you want to be a real doctor?"
Oh, God.
And she meant it. She didn't mean it in a derogatory. She had no
She
idea what an
didn't
ophthalmologist
understand
was.
it.
Exactly. But I had been, you know, raised to do what I like to do and be passionate about something. So I stood my ground, and I didn't become the plumber that they wanted. So
I remember before my father passed away, he always told me he was nervous because he kept saying, "Oh, someday they're going to find out you don't do anything. You fly all over the place.
Yeah.
You talk to people, have coffee.
Yeah.
What happens when they find out you have no skills, no trade?" You know, he says, "You'll be moving home with your family. I'll have to take care of you forever." You know, there was no maliciousness.
No, he was looking out for your best interest. He was trying to be
You know,
polite but supportive. Yeah.
In Portugal, they had their 4 years of school.
Yeah.
He was a magician with his hands.
Yep.
Put a tool in his hand, he can do
knew it.
anything.
Yeah.
So he never understood that, you know, my strongest tool was a telephone. I said, "Dad, I can do plumbing.
Yeah.
Just call Pintos. I can do electric. I call Brazza. You know, hey, Paul. You know, hey, Benny." He never could understand the logic.
Yeah. That was a different mindset, a different way. You make your own way in the world. You don't depend on somebody else to do those things.
So now, what do you think the biggest challenges are going to be as you go forward? I mean, reimbursement keeps getting worse.
Absolutely.
Technology demands keep increasing.
You're absolutely right. Yep.
Somewhere you get scared that the lines
That's
cross.
well, people are already up in arms around the country over this. We don't know what the answer to this is. It's evolving, and I don't think that anybody knows. Look at what's happening just in the Boston area, the consolidation with Partners buying
Yes.
hospitals. Everybody's starting to get nervous. Everybody wants to be one step ahead of the regulations and such. So we don't know. Something, you said it very well, something's going to come to a head. Might be later than sooner, but something has got to change because people want the best of care, but there's only a finite amount of money to pay for it.
Well,
And that's,
I remember when we were living in France. My darling bride and I were there for 4 years. And I loved socialized medicine because we were on a private payer plan. And the physicians loved us. But the French had taken it to a point where it just wasn't worth putting an extra 6 years of your life into training to come out and make less than a plumber.
Yes.
Or
yep,
make,
that's-
not that a plumber
yep.
was bad,
No,
but
I understand. I agree
you
with
come
that.
out,
Yep.
you go to work for somebody, you're
yep.
working. And for us, it was great because being on Blue Cross US, we got put to the head of the
Yeah,
line
yeah,
because
yeah.
we were those people that you look at and say, oh, they're private payers. But I really worried
yep.
because, don't take this the wrong way, but the guy who's got, or the gal who's got a very sharp knife to my eyes, I really want to know they're the brightest, the best.
I have the same feeling. I get paid for an operation, cataract surgery, the same as Joe Blow just out of his training one day. That's always been upsetting to me, that with my 30 years of experience, there's no differential in my, I guess the way to say that is the patients come to me because of that, perhaps, so maybe that is a benefit. But we're making 1/5 for what we did 30 years ago. Now, the cost of living hasn't gone down, 60%. It's maddening. It's absolutely maddening.
But you look at a lot of the people who are doing OBGYN.
Yes.
A lot of them just stopped
Absolutely,
and said,
yeah.
I'll stay with the gynecology because the obstetrics,
It's killing me between
I can't afford it.
Right, the malpractice coverage, absolutely. I just had a patient just today, a very well-known man from Milford, who was told that he needed cataract surgery, and I could have easily signed him up for surgery. I just don't have it in me. I sent him home. I said, you really don't need it yet. If you want it, we can do it. So you got to, in my opinion, you got to realize, leave that at the door in the morning, when and just deal with the patient as if it was your family member. But what you raise is a very good point. That's what we get discussions with at meetings and such. I was at the Hawaii Eye meeting 2 years ago, and we got invited out to dinner, for a drug company dinner. And I have a Hawaii medical license as well as my Mass license. And we still the reps got yelled at because Governor Patrick has since changed the law. In that 2 years ago, Massachusetts physicians could not be taken out to dinner.
See, the whole Chopke law
Yeah.
drives me crazy because if I could buy you as an MD for a pen
Yeah.
or a block
Yep,
of
exactly.
sticky notes,
Yep.
wait a minute, there's something fundamentally
I
wrong
agree with
here.
you. Yep.
That
And we use generics despite that they want us to use the brand name, but some of it makes sense, some of the rules and changes. Other stuff is just ridiculous.
Yeah, but see, there's where I feel more comfortable. You got a brandy new minted MD. Okay, experience of 1 year or 2, whatever it is. I kind of like the little white hair in 30 years of saying, for this kind of patient, I've run into 50 of you.
Yep.
Even though I think I'm unique.
Exactly, yes, yep.
Yep.
And I agree with that 100%. It's like the only time me and Rachel go anywhere these days is once a year we go to the Hawaii Eye meeting. And I remember standing in line to get on the plane and somebody said, I want to see a lot of gray hair on the captain. Well, it's the same thing in the operating room. But in that regard, I still have a responsibility. Despite 30 years, I don't know everything. I haven't seen everything. And so patients need to be able to have that trust that Dr. Goodman's going to treat them as best as he can, but if he's starting to get over his head, he's going to refer. And I think that's how I was brought up by the people that taught me. And so that's easy for me to play that role in the office. And I was, just on a personal level, I was out about 10 years ago with prostate cancer. and I was out of the office for a number of months. And people were, I was concerned about my health, and people were saying, well, aren't you worried about your practice? Yeah, I was worried about the practice. But suppose you're not going to be busy when you go back. And my answer was, I'll be as busy as I deserve to be. So, in other words, and I'm busy now as I was back then. So my point is that I enjoy what I do, and it's a lot of fun, and it's not all about me, it's about patient care. And these other social issues are terrible. And I hope that there will be a change in some fashion so that the good people continue to want to go into medical school, pay the price, it's extremely difficult, and still have a nice, happy career and happy family for the rest of their lives, I was, I was walking into the studio, I ran into Mr. Daigle from Joseph and Thomas Opticians. He is a gentleman, in my opinion, with a capital G. People like that are just wonderful, wonderful people, and there's a zillion of them in the Milford area that I've had the pleasure to meet. So it's a lot of fun, and that's what I try to carry forward in my practice. Yes. Yeah.
Well, that's old school.
Yeah.
That's back to the original 4 physicians that you knew who they were. And I always worry when you see a lot of, especially the primary cares, being told you have to turn a patient every 13.4 minutes.
Exactly. Yep.
And you sit there and say, wait a minute, 13.4 minutes really doesn't give you a lot of time to kind of create that trust.
Yep. And what you hear a lot is that, I've heard it from several patients, that the primary care doctor says, what's on your mind today? And the patient might list 4 things. He says, well, pick 2 of them, and we're going to tackle them today.
I don't have the time to talk about all 4.
Yeah.
Amazing.
I don't know. It's weird. I was operated years ago on Mr. Sidney Smith, who was
God.
Yeah, and he was a nice man. He's since, as you know, he's passed now, and he was just the nicest gentleman. And anyway, in his will, he donated because of me, several $100,000 to the hospital.
How wonderful!
It was amazing. It was incredible, And so you do the right thing for the right reasons.
That always gets back what you try
it's
and
amazing,
teach your kids, saying, do the right
Yeah,
thing,
yeah.
and then somewhere up there,
But
somebody's keeping score.
It's been wonderful. I never looked back. I was recruited here from BU, Boston University, where I was doing my training, and I haven't looked back. It's a challenge every day. We have tough cases sometimes in the operating room, and I surround myself with very good people. So even somebody like me who's, anyway, we worked hard, but we make it look easy because of the of the people, and the film crew picked up on that. They were so nice to come over and see us in action, and nobody was putting on airs or acting differently. It was just like, it was such a nice experience.
It's good to see,
Yeah.
as always, to our 6 loyal viewers, you're getting a flavor of old school. Somebody who cares about patients, but mixes it with the highest technology and quality levels available. So thank you for taking care of our families, and as always, may God bless, and may you have a better day tomorrow, and see sharper and more vividly for the future. Good night, all. Thank you.
Thank you.